G'day, I'm Jesse Crow, the travelling scientist, and last week we talked all about cancer, what it is and how we minimise our risk of suffering from it. And this week we're going to be talking all about different treatments for cancer. How do we beat this disease? Cancer is an uncontrollable growth of cells in your body, and there's a bunch of different ways to treat that. Most people receive a combination of treatments depending on the type of cancer, its size, and where it's located in the body. So let's look at these different treatment options. Surgery works best for solid tumours that are contained in one area of the body. It's a local treatment, meaning that it won't affect your whole body. But the downside is that recovery can be pretty painful, and there is a risk of infection. This treatment uses radiation to shrink tumours and kill cancer cells. Now, let's forget for a moment that radiation actually causes cancer. This is the equivalent of when your mum says, "I brought you into this world and I can take you out of it," if your mum was radiation and you were cancer. Anyway, the downsides of radiotherapy are that it's really expensive and it can also damage healthy tissue as well as the cancer cells. This treatment uses drugs to attack fast-growing cells like cancer cells. Unfortunately, it's non-specific, so it also attacks other healthy cells like your hair root cells, making you go bald, your gut lining cells, making you feel really sick, and your bone marrow cells, weakening your immune system to other diseases. Chemotherapy is really effective at treating cancer, but it comes at a price. This treatment is used for prostate and breast cancers that use hormones to grow, and essentially it just suppresses the production of those hormones that might benefit the cancer cells. That's it. That's all. So most of these other treatments are non-specific. They impact various parts of your body, damaging healthy tissue as well as cancerous tissue, and making you feel unwell. But targeted therapy uses small molecule drugs to specifically target cancer cells. For example, monoclonal antibodies can be designed to attach to a specific target that's found only on the cancer cells. These antibodies can mark the cancer cells so that your immune system will come in and destroy them, or the antibodies can be taken up into the cancer cells where they'll cause the cells to self-destruct, or they can even deliver toxins specifically to the cancer cells. Kind of like the horse of Troy, but microscopic. The downside of targeted therapy is that cancer cells can become resistant to these drugs, like bacteria become resistant to antibiotics. Can't win them all. Everybody normally receives the same treatment for cancer, but people respond differently, and this is due to our unique genetic makeup. Now, the concept of personalized medicine is that you could look at someone's DNA and tailor a drug specifically for that individual. Now, this may seem challenging, time-consuming, and expensive, but with recent advances in medicine, it's looking more possible that sometime in the future, you could have drugs specifically for you that are 100% effective at treating things like cancer or heart disease, or even just a headache. Now, this isn't realistic right now, but it could happen in the future, so get excited for that.
If you're excited, feel these nipples!
So a combination of these therapies can be really effective at treating cancer, and as research continues and new drugs are developed, better treatments become available and cancer mortality rates reduce. So if you or someone you know has cancer, there are plenty of treatment options out there, and for more information, please see the links down below in the description or talk to your doctor. Anyway, that's all for today, guys. Thank you so much for watching. If you learned something in this video, click the like button down below. If you have any questions or stories about cancer treatment, let me know in the comment section down below. Finally, next week's video is going to be all about a really interesting disease. I don't even know what it is yet. I haven't worked that out, but I will. Make sure you subscribe for more traveling science every week, and I'll see you guys next Science Sunday. Cheers.